So.
Right. I see Vicky's joined us now. I feel like we have everybody here and we should get the meeting started. I'm looking, okay, there's Alex. These meetings are hard because people always, the little screens move around. So I'm calling the meeting to order. It looks, on my computer, it looks like it's 6:06 p.m. And I'm calling the meeting to order for the Blue Oak Charter School. Let's have a roll call of council members so we can establish a quorum, please. And I'll call on people. Vicky? Vicky, are you there? I'll come back to Vicky. It's my next person. Okay, Vicky's here. Thank you, Vicky. Chelsea?
Chelsea Parker here.
Thank you, Chelsea. Laurel?
Laurel Hill Ward, present.
Thank you. Trisha?
Trisha Ateartua here.
Thank you. Laura?
Laura Swanson here.
And Heather?
Heather Bonilla here.
And Monica McDaniel here. Thank you. Can we have somebody volunteer to please read the school verse?
How about a parent?
Anybody?
I'll do
Want me
it.
to read it?
Heather, I'll do it.
Okay, great. Thanks, Heather. Thank you.
Yeah. Let's see. This is our school. May peace dwell here. May the rooms be full of contentment. May love abide here. Love of one another, love of our school, and love of life itself. Let us remember that as many hands build a house, so many hearts build a school.
Thanks, Heather. Are there any agenda modifications tonight? Nope, hearing none, I'm going to move on. Is there any audience to address the council about any items that are not otherwise stated on the agenda? Okay, no one? No one in the chat? All right, then let's just go ahead and move on.
Monica, I was
Yeah?
trying to unmute myself. I'm sorry. Can you hear me?
Okay, Jackie. I can't hear you, Jackie.
Hey, so I do have something to address the council. My name is Jackie Hammer. My daughter Sierra is currently in Kari Madera's 6th grade class. I have been a parent at Blue Oak for 10 years. My oldest now a sophomore at Chico High. I've been a member of parent council for 6 years, holding an officer position for quite a few of those years. I want to start by thanking you all for everything that you have done for our school. I'm coming to you this evening with a couple concerns. One, now that Butte County is in the purple tier, what does that mean for our school? And second, I think this might be addressed in agenda item 5.3.1 with classrooms being over 16. As written in the on-site hybrid option, it is stated that students wishing or requiring on-site programs will be divided into one of a maximum of 2 sub-cohorts per class. The sub-cohorts per class will be no more than 16 students. Knowing that Mrs. Madera's class will be well over the 16 when my child went back to campus, I opted for my daughter to return to campus solely on the concern that I have not been reassured, and if I had chosen distance learning for this semester, there would be a possibility that there would be room for her in her class because of the number of students on site. From my understanding, there are already waiting lists for classrooms. How is this being addressed? Why is there waiting lists as of now? Will the discussion of more than one cohort per class happen before more children have to be placed on these waiting lists?
Thanks, Jackie. And just to recap, I think you have a question in there. Or we can address issues that are not on the agenda, but I just want to make sure I'm clear about what your question is while you're still here. So your question is the size of classrooms that are over 16, and will students who are doing distance learning now have a place at Blue Oak if they're not doing in-person learning now? Is that your question? Or will they lose their spot potentially because of students on the waiting list? Is that your question?
Yeah, I think it more revolves around the waiting list, and if a child has been wanting to get back on site, but because classes are already capped, and why are there waiting lists? And when will the discussion happen that there would be more than one cohort per class so that there is not a waiting list?
And so there would be guaranteed spots for kids who are Blue Oak veterans. Correct?
Yeah, yes.
I wanted to clarify that. Thank you. Okay, thank you. Any other comments from the public? Audience to address the council? Okay, hearing none, let's move on to the consent agenda, please. So the consent, any council members like to discuss anything specifically on the consent agenda?
I had a
Heather?
question. Yeah, I had a question. In the report, the financials and actuals report, it has the attendance, and it has the projected attendance and the budgeted attendance. And I just was wondering why we don't have actual attendance numbers yet. Does anyone know that, or?
Chelsea
think
or
Heather-
Susan, would those,
Susan, you're
would you guys
muted.
know, or even
I was
Alex?
just gonna say, I think to discuss this, we need to pull it from the consent agenda, and then we can absolutely address these.
Oh, I just was curious about
So
it. I mean, it's not a,
Well, I think it's
I
a
don't
good,
think it's something worth pulling it, but.
Yeah,
it may be. Heather, let's get your question answered and just ask that that item be pulled. We can approve
Okay.
everything else, and then it won't take us very long to address it.
Okay, all right, great,
question.
thanks.
Yes, that is
which item
absolutely the point
specifically
of
is
having
it,
this
Heather?
opportunity.
Is it-
Huh?
Right,
Oh.
so which item is it specifically?
It is the charter, what is
2
it called?
point,
The charter impact
I'm looking for
monthly
that
report,
title,
I
I'm not
think.
seeing it. So what number?
2.2.1. 2.2.1.
So we'll pull 2.2.1, attendance and enrollment, gotcha. So we're pulling that one from the consent agenda. Would anybody else like to address any other details from the consent agenda? Okay, so let's vote on the consent agenda minus item 2.2.1 first, please. So do I hear a motion to accept the consent agenda minus 2.2.1?
Yep, this is Chelsea, and I'd like to accept the consent agenda with the exception of 2.2.1.
I second that.
Thank you, Chelsea. I have a first. Laurel is a second. Thank you. I have a first and a second. Is there any further discussion about the consent agenda minus item 2.2.1? Okay, hearing none, let's have a roll call vote. I will call on Charter Council members to weigh in on the consent agenda minus that one item. Vicki, I'm always going to start with you because you're at the bottom, okay?
That's fine.
So
Vicky
Vicki,
Wanacott, aye.
thank you. Trisha,
Trisha out there too. Aye.
Chelsea,
Chelsea Parker, aye.
thank you. Laura,
Laura Swanson, aye.
Laurel,
Laurel Hill Ward, aye.
thank you. Heather,
Heather Bonilla, aye.
Heather, you're next. Thank you.
Heather-
And Monica McDaniel, aye. So the consent agenda passes. Mika? Yeah, okay. So let's go back to item 2.21. Can you guys address Heather's question? Let us know if that's answering your question, okay?
I'm going to refer that to Jim and let him address it.
Okay,
Specific, specific to attendance. One reason is because it's not directly impacting funding this year, as long as all students attending have their time documented, the rules specific to 2021. It doesn't come into play the way ADA tracking comes into play. The other reason, and I do apologize for this, is actually I don't know I don't know what the attendance is. I have an answer. So it's something we can add. We'll just have to mark that ahead of time to make sure that gets included in the reporting. But it didn't have the, it would normally be like a key point in a discussion would be the status of the attendance trend and the ADA trend. And it didn't have that pressure because that wasn't going to define funding this year.
Do we have actual enrollment numbers yet?
I don't have that answer.
I do. Yes, we do. And
Susan, do you?
yeah. Yes, and actually it is somewhat addressed in my executive director's report. We are at bouncing between 294 and 297 in our enrollments. So, and that's been real consistent since the beginning of the year. Attendance is a lot harder because because of the way that they have directed us to track it. So it's not our usual sort of if they're here for the day or not. So it's a little more confusing than that for teachers and for all of us. But the enrollment is stable at 294.
Thank you.
Okay. Thank you. And I have a further question. How many people are on the wait list? The wait list that was mentioned earlier. Do you know that off the top of your head?
No, I don't. I'll discuss that when we talk about that item, if that's okay, Monica, because I'm not sure.
Okay.
It's
Sure.
not a wait list for the school and that it's, yeah. And part of it is, anyway, I'll explain it at that.
And my
point,
next,
talk about that number.
okay, great. And that's fine. I'll wait for that. My other question at that time will be if there is a bulk of people on a certain grade level for the wait list, whether it's kindergarten or middle school or whatever, that would be my follow-up question when that time comes, just to kind of front load that for you. Okay.
All right.
Because I'm curious what grades could be impacted. Thank you. Okay. So let's move on to school governance. And so we're going to start off with the finance committee and Chelsea Parker by candlelight, please.
Before we do that, Monica, I would like
Yes.
to make a motion. I would like to make a motion that we approve item 2.2.1.
Thank you for circling back, Chelsea Parker.
Heather Bonilla, I'll second.
Thank you. So I have a first and a second for approving item 2.2.1. Is there any further discussion about that item? Okay, hearing none, we'll have a vote. Vicky, we'll start with you.
Wanacott, aye.
Thank you. Trisha?
Trisha out there to aye.
Thank you. Chelsea?
Chelsea Parker, aye.
Thank you. Laurel?
Laurel Hill Ward, aye.
Laura?
Laura Swanson, aye.
Thanks. You guys are right next to each other. So Heather?
Heather Bonilla, aye.
Thank you. And Monica McDaniel, aye. Thanks, Chelsea. I would have forgotten about that. Okay. So now we're moving on to item 3 for the finance committee, please.
Okay, I'm gonna do my best to read my notes by candlelight. Let's see. So one of the things that we discussed is overall finances are actually looking pretty okay, except for we may possibly have a short-term borrowing need like the June, July, August timeframe if our accounts receivable get further delayed. If they've already been delayed, if they come in now where we're projecting them to come in, then we should be okay. Let's see. We went over the medical insurance premium information, which we have as an item tonight, so I won't get too far into the weeds on that. I'll chime in when we discuss that separately. And then we had started discussing marketing as part of the enrollment that was discussed earlier. Susan gave us some information on a few of the marketing firms that she'd talked to, and I will not steal her thunder because I saw that also in her her report. We did also talk about just kind of some of the baseline things for wanting to keep on top of those enrollment numbers as we go into next year, and some options that could bump those up, as well as just staying on top of where the progress for the facility is. And further information on those things I saw in Susan's director's report. So we'll talk more about those. But other than that, we really there's not. Oh, the other big thing, I almost missed this. And Susan, I'm sorry if you're going to cover this in your report, but I'm very excited. They were able to find an employee assistance program, or EAP, which provides, for those of you who don't know, like some mental health support, and some on-call counseling type services for those who need it, which previously anyone who was covered under Blue Oak's insurance plans already had that as part of their plan, but any of our staff and faculty that were not taking the insurance didn't have access to that. So Susan was able to find, and her team and our insurance team were able to find a very affordable option for us to be able to extend just those EAP services to all of the faculty and staff members, which is so huge, especially in a time like this where stressors are high and there's a lot going on. So that's excellent news, and so I was excited to share that with you. But that was about it from my notes.
Thanks, Chelsea. In terms of mental health services, I just also want to let everybody know that Butte County Office of Education also offers crisis support for teachers, for families, for students. They just really are all about the crisis support. So if anybody needs it, let me know and I'll connect you with the right people. And they've been very generous about that. And I really love seeing Blue Oak people at some of the BCOE meetings for support. So it's kind of cool how that's going from them. Thank you so much, Chelsea. Any questions for Chelsea before we move on? Okay, hearing none. The next item is medical insurance premium options, Leanne and Dana. I don't know Leanne or Dana, so I will just let them kind of,
Awesome.
Are they here or who's?
Yes, Leanne is here. I didn't make Dana stick around this late. I told her I would do solo.
Hi, Leanne.
Hey, how's everybody? Nice to see familiar faces.
Okay.
You guys are saints.
Great, thank you.
That's all I'm saying is you guys are absolute saints with what you're doing through all of this for the kids. So thank you for all your hard work. So we did, as usual, go out to bid. You know, we moved the group last year, January 1st, to Anthem Blue Cross from Blue Shield of California so that we could align the calendar year deductible with the calendar year. What a concept. In the past, we were doing it kind of middle of the road, which caused a lot of confusion and little bit of heartache and frustration with some folks. Overall, I think it was the right move, especially in light of they have come in with a minimal increase this year, one of the smallest increases we've seen in several years of doing insurance, and are well below any of the other insurance companies that we shopped. And we did take a look at Aetna, Blue Shield, Covered California, CalChoice, HealthNet, and United Healthcare, which are all in our small group market up here. So Anthem by far is the best. In looking at it though, as it occurs every year, the insurance company and Department of Insurance has made some changes to the benefits, which are going to take effect on January 1st. So what you're looking at right now on that first page is the current benefits as they stand. And as you can see, we have 6 employees that have bought up, so to speak, to the silver plan option, and we have 11 employees that are on the bronze plan option. The way these plans work, anything in red on that page is not subject to the deductible. So employees realize the upfront benefits, preventive services at no charge, the tier 1 medications with those copays of $20 or $50 for mail order, and the office visit copays. Silver plan having unlimited office visits, whereas the current bronze plan, each person that was insured on the plan, so that's each family member, had a limit of 3 visits per year. I call those kind of sick visits, so to speak. So if you go to the next page, you will see our renewal option with the mandated changes. So on the silver plan, the deductible has gone up from $2,000 to $2,200. The what I call catastrophic stop loss has gone from $7,900 to $8,150. And again, these were changes brought to us by Anthem, not on any part of the school or our recommendation. But otherwise, the changes are minimal. A couple things that I do want to point out is if you look at the prescription drug portion, each tier of medication, tier 1, tier 2, tier 3, and so forth, has now 2 different copays there. Tier 1 medications are primarily your very basic generic medications. And the reason we're now seeing 2 different tiers within, or 2 different levels of copays within each tier, as if insurance isn't complicated enough, is that they have made some bargaining agreements with some local pharmacies where you will have the lower copay if you access your benefits at that pharmacy or pick up your prescriptions at those pharmacies. And here in Chico, we have CVS, Costco, Safeway, and Walmart. There may be some small independent pharmacies in the outlying areas, but that is what we have here in Chico. The other change that they were able to do is on the diagnostic lab work. Again, they went out in an attempt to try to keep costs down, and they negotiated with Quest Diagnostics. And if you have your lab draws done at Quest, you can take your lab slip that your doctor has given you from the physician's office and go over there, then you'll get your labs done with no copay. You see that if you have them done, there's a blue copay of $20 in the physician's office, but we have found that most physicians ship their labs to a hospital setting quite often for reading, or perhaps a lab that did not want to negotiate for lower pricing. So you would, in that case, be subject to paying the reduced negotiated rate until you have met your plan deductible. So that $20 is a little misleading. I know there are, like your Enlo Prompt Care, I believe, has their own lab facility. So things like that, you would probably have the $20 copay. But so those are kind of across the board with all of the options. On the bronze plan, last year we had some upfront office visit copays prior to having to pay towards the deductible. And this time it wasn't Anthem, it was actually the Department of Insurance that squashed that and came back to Anthem and said, when you do these plans in 2021, that needs to be changed. Those benefits are richer than the bronze plan level, creating an unfair market for the other insurance companies, sadly. So with the bronze plan, the folks that are on the bronze plan, you still have the advantage of the reduced negotiated rate. And quite frankly, if I were to go to prompt care, they would probably bill that visit out at about $120 just for a general visit. The reduced negotiated rate's probably somewhere in the neighborhood of $72 to $80. So under the prior plan, you had the $60 or $80 copay. Here, you're going to be kind of in the middle of the boat, not a huge impact. However, in an effort to offset that, Anthem has increased the Live Health online visits from 3 visits per person per year with no copay up to 12 visits per person per year with no copay. So any questions so far on that? Okay,
I have a
hearings.
question. I have a
Yes.
question. And I'm asking, thinking of the teachers, but is this, I mean, how does this work out with Inlow? Are they still not accepting Anthem Blue Cross?
No. So what you're hearing in the news media now, and thank you for asking that question, I appreciate that. The commercial plans renegotiated their contract with Anthem last year under a multi-year contract. What you're hearing in the news media now is strictly Anthem's Medi-Cal contract, not these commercial plans, not the individual plans, not your Medicare plans, but strictly the Medi-Cal contract. So good question though. So no, Inlow, we are free and clear for a few more years under the multi-year contract.
Okay, thank you.
Good question. There was just over a 3% increase on these renewal options. Like I said, it was minimal. And one of the things the school did mid-year was to try to negate their exposure by going with a defined contribution. The school still will be picking up a part of that because some employees were not using their full allotted amount on their premium, all those young folks. So there still is going to be a little bit of shared increase to the school and to the employees under these options. If we go to page 3, we looked at some other plan options that were less costly and would actually result in a very slight savings to the school and literally a couple $1 or $2 savings, sometimes $5 to employees as well. And when I'm saying savings, in my world, we kind of talk monthly. So keep that in mind as you're going through this. So it would actually be some savings. You can see that there are some additional benefit reductions, but there's also a couple things that I did want to point out. So on the silver plan, your deductible would actually be $2,500. So that's even up from the $2,200 on the renewal versus the $2,000 on the current. Same office visit copay, same catastrophic stop loss. But the benefit on this silver plan is you may notice at the bottom, there is no prescription drug deductible if you have a tier 2 or tier 3 or tier 4 medication, whereas on the renewal plan option, there is a $250 prescription drug deductible. So those people that are on the silver plan primarily for medications may actually want to consider moving to this silver plan, realizing some deductible savings out of pocket, as well as, maybe a whopping $1 to $5 in premium cost. We originally thought, it would be an either or, but upon the finance committee's recommendation and inquiry, they asked if we could in fact give employees the choice of any and all of these plans, and absolutely we can do that. So I think it's nice to give the employees more options on what really meets their needs. The bronze plan option actually has a lower deductible of $5,600. And then you go into what we call our co-insurance world of 40%. until you hit the out-of-pocket maximum, which is higher at $8,400. But instead of having to pay the first $6,350, if you're receiving ongoing services, you pay the first $5,600 and then have the shared cost where Anthem's picking up 60%, you're picking up the 40%. But and then the other thing on this bronze plan option that you will really want to be careful of is that all of the medications on this option are going to be subject to that $5,600 deductible. Whereas on the other bronze option, you did have the deductible of $625 and then had the convenience of the co-pays on the tier 2 and tier 3 medications after that. So just a few things to be aware of on that. But like I said, it will result in either little to no increase or actually a few dollars savings to folks that may want to hop over to one of these last two options. Additional questions?
I have a question, Heather.
Yep.
For the bronze plan, does this mean, so I guess it's kind of a two-part question. Does this mean that office visits and all of these other services are not covered at all until the deductible's been met?
That's correct. Well, they're covered. You're getting the reduced negotiated rate, but all those, that's going to go towards your deductible now. Whereas before, if you walked in with your current bronze plan to your doctor, you knew you were going to pay $60 up front.
Okay.
Under the two bronze options now, and again, this was a Department of Insurance thing, this wasn't even an Anthem thing, you are going to be somewhat at the mercy of how the doctor codes that office visit. And if they code it as a brief office visit for an existing patient, you likely will pay, like I said, somewhere between $70 and $80 for that office visit. And that would go towards your deductible. The way it worked previously, like I said, you knew it was going to be $60. That wouldn't go towards your deductible. It would go towards your out-of-pocket maximum. But in this case, it's going to go towards your deductible first.
And that's the same for the prescription drugs coverage. There isn't any coverage on prescription drugs until you've paid your whole deductible.
You have it on the tier 1 medications, and sorry that did not get put in red. It's bolded, but yes, you still have the tier 1s. You get to have those copays up front. You have your annual physical and all the treatment lab work associated with that, mammogram, pap up front, no charge. And again, you have the 12 live health online visits, not subject to the deductible. Yep. So those are the areas that you have up front is the tier 1 meds, the preventive services, and the live health online. But yes, otherwise you have that reduced negotiated rate. So if you are somebody who is considering this on a bronze plan that has some medications, before you take the leap, I would recommend you reach out to somebody in our office. And we'll be getting materials out soon with all that information. And have us do a little bit of research for you, because the last thing we want is for somebody to move and end up thinking, well, wow, I'm going to save, $60 a year, but it ends up costing a lot more out of pocket. We want to avoid those situations.
Is it appropriate to have conversations with your doctor about the best coding related to your insurance plan?
It is. They sometimes take that very well. Sometimes they say, I can't change my coding. But yeah, if you say, hey, I'm on a plan that everything goes towards my deductible, show me some mercy.
Yeah.
I think, if you kind of do it
I don't
that
think
way.
it's inappropriate.
Yeah.
Somebody has discretion in how those things are coded. So it
Exactly.
makes sense to me.
Exactly. Yeah, no, absolutely. And I'll be honest with you, I have gone into a doctor before for what I thought was my annual physical and mentioned, having a shoulder pain or something. And all of a sudden, man, they flipped that code from preventive to diagnostic, and it costs you way more money. Not saying that you shouldn't be talking to your doctor about what's bugging you, because, that's why we're going to the doctor. But yeah, I think it's a kind of all in how you approach it with the doctor. And if you just say, just a heads up, everything's going towards my deductible on this, just wanted to be upfront with you. you can't really ask them to do a fraudulent code, but there's nothing wrong with explaining and being educated and letting them know that you know what
Yeah.
your benefits are.
So this is
Other
Chelsea.
questions?
This is Chelsea, and this is not a question, but this is for my fellow board members. And typically when insurance comes to the finance committee, we have multiple plan options like this, which we review and kind of look at all the nitty gritty details to determine which silver and which gold plan are the best to offer our employees. And we look at like what the total package cost is to the school and to the employees and what benefits. And this year, because the price difference to the school is negligible between the two silver options and the two bronze options, we wanted to recommend to the Charter Council that we actually offer all four of these plans, both silver and both bronze plans, to the employees, like Leanne said, so that they can, meet and they can meet one-on-one with the insurance people, like Leanne and her counterparts, to pick specifically which plan is the best for each individual. Because where some of these plans fall, like in some of the areas that the plans may fall short, actually might benefit one employee in the areas that it excels versus another employee. So that's our recommendation, is that we approve offering all four of these plans to our staff and faculty this year.
Great idea.
Yep. And again, we are here, our staff is here. I know COVID is strange times, but and when the plan information goes out, it will have all our contact information, emails, phones, what have you. And it's actually kind of nice to be able to do a one-on-one consultation if you have questions, versus us coming out in a group and everybody's anxious to get out of the meeting. And by the time you get ready to go, you forget what your question was. And so, this is kind of a good thing that we're going to have the capability to really provide some quality one-on-one consulting.
So I had a question, and Chelsea, I guess I'm kind of directing it towards you and Susan. I like hearing that there are 4 different plans available, so people could customize what they want and what they need based on their needs. How does this plan compare to what we offered last year? Because I remember last year there was some there's some surprises and there was some other stuff that came up. I mean, how is this versus last year's plan? Is it the same, but with just more options? Is it different? Because it sounds great when I hear everything on this end, but I'm remembering some of the stuff from before, from last year's insurance, and how does that weigh out for all of this? And that's to you, either you or Susan.
Monica, this is Chelsea, and that's kind of some of what Leanne was discussing was kind of all of the slight changes in the plans. Unfortunately, as every year, Anthem doesn't offer the exact same plan. So these, some of these are very close to what they offered, and then some are slightly different. But then as far as cost goes, we're actually really, really fortunate. I don't know if you heard Leanne earlier, but I think she said it was like a 3% increase, which is, I think last year was, Leanne, you can correct me, but I think it was like a 12 or 14% increase in cost. So this will be pretty minimal, both for the school, but also to the employees. It's a very nominal change. I don't think we'll ever see insurance prices go down, but I would say, especially in light of all of the concerns that I know I've had, and I think many people have had, over what kind of major jumps we might see because of COVID, I think this is pretty astonishing that it's only a 3% increase. So there will be some cost increases, Monica, to answer your question, both to the school and to the staff, potentially depending on really what plan you go with, but it's pretty minimal.
Great, thank you. And Susan, did you want to add?
Well, I believe, Leanne, did we have the first page? Wasn't that last year's
Yes, the first page was
Okay,
last
yeah.
year's plan
Yeah.
benefits,
Can we,
which,
Alex, can we scroll back up to that?
and I can hit the high points like I did before. So silver plan was 2,000 deductible, renewals 2,200, the other options 2,500. Stop loss 7,900 is the current. It's going to go to 8,150 regardless of which silver plan you go with. Office visit copay $50, the renewal $50, the second silver option a little bit less money is $55. So there's not a lot of huge differences on the silver plan. I think probably my biggest thing that I'm seeing is that you used to have those established copays on that bronze plan of $60 or $80. And now you are going to be subject to how that gets coded by your physician. You still get the discounted rate. And, but that's where it's okay to bring that to your physician's attention. And it doesn't matter which bronze plan you're going with, that's going to occur. That's my biggest concern on the two, along with if you go with that third bronze option, you just need to understand up front, if you have a tier 2, 3, or 4 medication, it could become very costly.
Right. And my question hinges more on, instead of what's available, last year there was some big surprises among our staff and faculty in particular. And so I just, maybe with the way Chelsea explained it, in the increase for 12% from last year, maybe caused those surprises and those
Yes.
concerns. And then this year it's only
Also-
3% difference. I just wanted to discuss on the front end, and so that it wasn't a surprise when we go to approve it. Yeah.
Yeah, so one of the big differences,
Yeah, I'm here.
Monica, between last year and this year was that last year we changed from an employee defined, so where they had a set amount that they contributed, to an employer defined. So the changes were more than just the percentage of plan increase. There was actually some pretty drastic changes that we made as part of adopting the new pay scale. And so that's where a lot of that came in, I think, because a lot of parts and pieces were moving. There was a lot of confusion around that. So I agree that it's imperative that our faculty and staff be really well aware of all of that. And so I think, and I would ask Susan, I'm sure she's already planning on it, but I would ask that, as when it comes time, or when the board does decide on whether or not we'll be approving this, that we very quickly encourage our faculty and staff that are interested in taking benefits to get those one-on-one appointments scheduled, to make sure that they are armed with all of the information and understand the changes. And we're fortunate that Leanne and her team offer that.
Right.
Yes, we will. And I also want to say, Leanne started by talking about the fact that we went through the process of changing to start in January rather than in October. And that was a tough change too. So we did a couple of things last year with insurance.
Mhm.
And just the timing of it now, by being able to look at this in October and November rather than in July and August, makes it just a time when we will be able to communicate it more easily and clearly. And the actual coverage of insurance goes right along with the beginning of the year. So that will be a better year for faculty and staff as well that way.
Great. Thank you. Anything else about the medical insurance premium options that we need to go over at this time? Thank you again, Leanne, for helping us and helping our staff and faculty with insurance. Health insurance, it's so important. It's
Yes,
for everybody.
it is.
And for their families.
Now more than
Yeah.
ever, I think we all have a big appreciation for it. So thank you all.
Right, absolutely. Have a great evening, and thank you for joining us.
Thank you.
Let's move on to item 3.4, the board training discussion, please.
Monica, I need a motion and approval for this. for the
Oh,
insurance
okay.
plan.
Sorry.
Thank you.
Okay. So after all of that, do I hear a motion to approve the medical insurance premium options that have been put forth before us tonight?
This
Anybody?
is Trisha. I'll make a motion to approve the health insurance that's been presented.
Great, thank you. I have a first. Is there a second?
I'll
Well,
second
no,
that.
no, Go ahead.
All
Go
right,
ahead,
Vicki, you got in first.
All righty.
So we got Trisha as a first and Vicki as a second. Thank you. Is there any further discussion about the medical insurance premium options this evening? Okay, hearing none, let's have a vote. I will call on board members. Vicki, you're first.
Vicky Wanacott, aye.
Chelsea,
Chelsea
you got
Parker,
moved
aye.
down on my camera. Thank you. Trisha,
Trisha Atayer, aye.
thank you. Laura,
Laura Swanson, aye.
thank you. Laurel,
Laurel Hill Ward, aye.
thank you. And Heather.
Heather Bonilla, aye.
Thank you. And Monica McDaniel, aye. All right, guys, thank you. And thank you for creating some normalcy in our annual process. Thank you. Okay. So sorry. So item 3.3, policy review.
So this is the second read of the quarantine personnel policy that addressed how we would support staff and faculty during COVID-19 crisis. So this is your second read. I was asked to look into, whether or not employees needed to use their sick time in order to get a longer leave from the state if they needed to. And the answer to that is yes. They need to be offered their required sick leave. They need to use it. And then, runs around 2 weeks. And then they can apply after that for the 10 weeks at the state level. So, so I propose that we do not make any changes to this, that we go ahead and leave the policy that does expect teachers or staff to utilize their sick time in that case.
Thank you. Is there any questions or comments about the oh, gotcha. The COVID-19 personnel policy policy?
This is Chelsea, and the only comment that I have is just how much I really appreciate this. It's I think really important for us to offer, because one of the big things, even though staff have to and faculty have to use their sick time to be able to qualify for the extended leave, that's only in the instance that their test is positive. What this policy really does offer our staff is pay without having to use their sick time for those times where they have a potential exposure and have to miss awaiting test results. And I think that's so important for us to support our teachers, that we're asking to be with students to have that, so that if they have the inkling that they've been exposed or have an issue come up, that there's nothing holding them back from getting tested and ensuring that they are safe, as are their students. So I think this is really great.
Thanks for that recap, Chelsea. Any other comments or questions about this policy?
Heather.
Oh, yeah, hi, Heather.
Yeah, so I just wanted to thank you, Chelsea, for clarifying that, because it was kind of going over my head there. So just to confirm, staff and faculty do not have to use their sick time if they are being tested and waiting for results. They only have to use their sick time if they actually have a positive diagnosis, and then they're using their sick time to recover, and they can file for extended sick time from the state or whatever if needed. Is that the right understanding? Thank you.
Okay, do I hear a motion about accepting the COVID-19 personnel policy?
This is Heather. I'll move that we accept the Blue Oak COVID-19 quarantined personnel policy.
Laurel, second.
Thank you, Heather. I see. Thank you, Laurel. I have a first and a second. Heather was the first, Laurel was the second. Any further discussion about this item? Okay, hearing none, I'll call on board members to weigh in. Where did Vicky go? Ah, Vicky.
Vicky Wanacott, aye.
Thank you. Trish.
Trisha Atea Tua, aye.
Thank you. Chelsea.
Chelsea Parker, aye.
Thank you. It looks like you're having your own personal lantern walk, Chelsea. It's very Waldorfy. Thank you. Laura.
Laura Swanson, aye.
Thank you. Laurel.
Laurel Hill Ward, aye.
Thank you. And Heather.
Heather Bonilla, aye.
Thank you. And I'd like to echo the thanks for getting this policy in place to protect our faculty. Monica McDaniel, aye. Okay, thank you. So let's move on to item 3.4, board training discussion. Susan, it looks like you're leading this also?
So last month we were able to give everyone access to, or we had talked about getting everyone access to the Brown Act training online and the governance training. And I just wanted to give the board an opportunity to share anything they learned, or if you're having trouble access it, let us know that too. So.
Any comments or questions about the online Brown Act board training?
Well, this is Chelsea, and I'm just going
Thank you for offering that.
I'm going to admit that I have not had the opportunity to complete mine.
Thank you. But we were all at the BCOE one too, though, huh?
Last year, right?
Yeah.
Yep.
Yes, but we do still have to do
Yeah.
it every year, Monica. So.
Yeah.
Right. It's good to keep up on it. So thank you for making that available for us and online.
Okay.
I just finally got ready.
Okay. Other board members, questions or comments? And board members also have to do a 700 form every year, don't they?
Yes. And there's a training on that.
Okay.
As well.
Questions or comments?
This is Heather. I just
Okay.
wanted to thank
Great. On that same resource?
oh, thank you for setting that up for us.
Yeah. Yeah, thank you so much. Okay. Ready to move on? All right. Item 3.5, the hybrid reopening model. Susan, did you want to talk about that? Special
Yes.
classes, item 3.5.1,
Yes.
special classes 16 plus members. Okay.
Yes. So in our, so there's two really issues that I want to address under this topic. And the first one I'll put forward is that the governor changed a majority of the state, including Butte County, back to the purple tier, which is the tier that is the most significant as far as cases in the area. And we did have a significant increase this week in our cases and are already pretty high just in one day for next week's report. So now that we have opened, even though we've gone back to the purple tier, the school has the option of staying open in that tier or making the choice to close the on-site program again. And that comes back to the board to see what it is you want to do. This information just came out yesterday, so I am not feeling prepared to recommend anything to you. I will be meeting with charter leaders tomorrow and with Mary Zakuma from the county office. So I might have more information and ideas after that. What we're seeing as a whole in education is that as a community goes up, the schools are pretty much stay in sync with the community. They don't make it worse, but they do also see cases at the schools. So that is the concern that we have and we need to discuss. Then the second issue is that, and I'll start with that and then we can go back and talk. I'll ask for discussion on that first, and we can go back and talk about the school staying open or closed. Because I really do want to get your information and input before I go to the meeting tomorrow. So after last month's meeting, we had said 16 people in a class because of the sizes of the classrooms. We know that we have room for 20, but 20 gets pretty tight in a class. And so we had held it to 16. At the meeting also, there was a discussion about the fact that we were only 2 days a week and could we expand that further? So when the surveys actually came in, we found that there were only a few classes and now really only one that had more than 16 students. So we were looking in that decision-making process of having about 4 students that were asking to be on campus, that we would be reducing all 171 students to 2 days a week, or keeping that 2 days a week in order to fulfill the requests of those last 4. So it felt more appropriate to open the 4 days a week and then work with those teachers who had higher numbers and see if we could expand their class in some way or address that. So we're now actually down to just one class that has more than 16, and that class at this time has been moved into the great room so we can expand and give the class about 200 more square feet to fit those additional 3 students. But we're also being very judicious about increasing the numbers of students on campus, and also following that sort of core Blue Oak plan, which has us only putting students into classes on Mondays and allowing for the teachers to not have students, to be real secure in when students will come into their class. I also asked that we not make any changes, if at all possible, over the first 2 weeks of classes, so that as teachers were adjusting to this new model and to combining the 2 models, they also didn't have students, new students coming into their class. So I asked that to wait as a whole until after the Thanksgiving break. And that's just administrative policy, following through on past administrative policy. So now we do have a few classes where there are 1 or 2 students that would like to be in the on-site program that are not. And as you know, we do with the fluctuations, we talked about the enrollment later. If a student leaves then we allow another student on, and that's what we've been doing right now. I think that I've counted maybe 5 students. These are not students that are necessarily new to the school. These are students that have changed their minds from distance learning to on site, and we have them going back, requesting one to go one way or another, and we're trying to manage that so that it's not an impact on the teacher and the class as a whole as students move in and out. So that's the story behind it. So what I have it on the agenda for and to ask you is to approve that one class that is over 16, and if you would like other classes to be over 16 in order to accommodate additional students, that's another option for you.
This
Hi,
is
Heather.
Can I go? Awesome. We have a weird delay. I don't know if it's me or if it's on the other end. My question was, is it feasible, or would it be too much of a hardship, implementation wise, to have those overflow students join another class that might be lower numbers? Like, so if one class is already maxed out at 16, but maybe the other grade level class, or maybe a grade level class above or below is only at like 8, could those students maybe still come on campus but with a different teacher? Or is that just too much complication? I don't know.
Yeah, so I think I'd have to talk to my implementation team about that. It's a good idea, Heather. But I'd want input from them. Are we talking about having a couple of students doing distance learning from another classroom so that it's not the physical distancing that's an issue? So I can take that back to the team and see what they think. I wouldn't want for you and I to say, yeah, that'll work.
Yeah.
Talking to the staff. Yeah.
Thank you.
Uh-huh.
And my question circles back to what the parent, Jackie Hammer, was asking in the beginning. I just want to be clear, when students choose to do distance learning, well, then do they have a place guaranteed in the classroom for them, or do they give up their seat in the classroom by choosing distance learning?
So because we're asked to go for more than 2 days a week, and we're able, for the most part, when the survey was done, to fulfill the needs of the majority of students who wanted on site at 4 days a week, we did that. So in order for us to say everybody could be on campus, we would have to cut that back to either 2 or 3 days a week. So that would be the next step if we decided we wanted to make sure of that. That didn't seem to be the way it was going in the meeting when we had it last week. People were really, let's get them on campus more if we can. And so we went in that direction. And we did at the time, how you do. 3 times we sent out a survey and say, tell us what you want. We're going to make decisions based on your decision, based on your decision, we're going to decide what we're going to do. And we did that, but yet people were still unsure and thinking about it. And then now they're saying, gosh, we'd really like to go back to campus if we could. So that's sort of where we are.
Just to clarify though, Susan and Monica, is students that opt to be on distance learning don't give up their seat with their teacher. They just give up the opportunity to guarantee being able to come back to campus right now. So like for myself, I opted for my son to remain on distance learning. He is still part of his same classroom. He has his same teacher. And when the time comes for our campus to either fully reopen or whatever that looks like in the future, he will at some point be able to return to his class. He doesn't lose his spot in the class just because right now it is full and he doesn't have the opportunity, like I can't just change my mind and send him to school, but he's still part of his same class.
Right. Thank you for that clarification, Chelsea, because I wasn't hearing that in your response, Susan. What I was hearing was, well, a certain amount of parents said they wanted to do in-person learning at this time. We've got so many seats set up for in-person learning, and that can't be expanded or contracted necessarily. That wasn't really what I was asking. I was asking more what Chelsea was saying.
Okay.
Does that make sense?
All right, it does make sense.
Not campaign.
Okay.
Vacillate between the two, but whether they would be guaranteed in that class. So thank you. Thank you. That was good tempting. Any other questions about the, and so the other thing to think about, and I heard Susan say this, and I want to clarify this, is that Susan will have a meeting with BCOE with Mary Sakuma tomorrow. I know I'm sure a lot of schools, oh my God, we've gone back meeting tomorrow. I think Susan's asking for, no students meeting tomorrow. I'm asking for direction from the board about what questions of the per tier, whether to stay open, all those pieces. So does anybody have those sorts of direction? And then I think that having our meeting, another meeting in December about whether we're going to stay open after Thanksgiving or stay open beyond this is probably going to be at hand, considering we've gone back to the purple tier with more information. Is that correct?
Yes.
Heather, did you have someone to say? I see your hand. Yeah?
Yes.
Okay,
I
Heather?
just wanted, thank you. I just wanted to applaud the problem solving that went into that one class that wanted to accommodate extra students and moving them into the great room so that there would be more physical distance between the students. Seems like a really good solution, so long as the faculty for that class was comfortable with that number of students. I do also want to share my personal opinion that considering that we are seeing a really fast increase in cases in Butte County and our sudden move back to the purple tier, I don't think that I personally would be in favor of increasing the number of students in individual classrooms across the board. I feel like that would have to be kind of a case-by-case decision that was made.
I agree with Heather.
This is Laura. I'd just like to add that what you said, Heather.
I think that there are people who are going to want to continue with this.
Monica Laura had a comment.
Where'd you go, Heather? Where'd you go, Laura?
I think we have a little delay.
Yeah, I think I have a delay. So I think I start talking and then people don't. Yeah, I think I start talking and people don't tell I'm Laura, ahead.
I was just going to say that I want to second or third what Heather and Laurel were saying. With us recently going back to purple, it doesn't seem very prudent to me to add more students. That's just where I'm coming from.
Thank you. Brianna also told me I'm breaking up a little bit. It could be the wind outside. So
I had something too.
I was going to say, I think that there might be. Okay, go ahead.
I just wanted
go ahead,
to,
Chelsea.
I just wanted to say, like, I agree and not blanket approving an increase in classes. I also just want to remind everyone that although we have seen a spike, if you will, or an increase in cases, that moving to the purple tier has to do with our the percentage of cases that have increased, and because our numbers were so low, that, you know, yes, our numbers, we've quadrupled the number of cases in a short period of time, which is concerning, and I'm not at all trying to downplay that. But I would be very concerned if we made the decision at this point to re-close the school down, because you know, the numbers reported today were 206 cases in total in our entire county. So I don't feel like I don't feel like making the move now to close down the school is something that I am interested in seeing, although I don't want to see the class sizes grow. I think continuing where we are, being mindful of the numbers and watching that, but just remembering that, you know, the reason that we go into purple and the reason we have these 2-week cycles is to help kind of interrupt the growth of this. And so I definitely think we should let that happen and continue to be extra cautious.
Monica, I'll let you go because you've been trying to go, but I have a comment too. So.
Thanks, Tricia. I just was gonna say, I think there are gonna be people wanting to continue the distance learning going back into purple. You know, I think both sides of it that are still really present. And so I appreciate your comments, Chelsea, because you want to make sure we balance the safety and the caution for people who want to do distance learning, especially as we move into the purple tier, and then also consider the overall health for the campus. So it's very delicate. Thank you. Tricia?
Yeah, so I would agree with that I think closing the school back down would probably not be in the best benefit of the kids and the family at this point. And from what I understand, if those individual families decided they wanted to go back to distance learning, they could do that at any point, and kind of make that decision, and we kind of see how it goes from here as far as making the decision to reclose the school, but not increasing the class sizes. I would be in favor of that as well.
I want to make one more comment, and that's that I would love to see the outdoor possibilities utilized to the best of our extent. I'm not sure if I've heard a lot of that in the planning that isn't present, but I just like, even when I look at the document that's up, when it talks about restaurants and then restaurants being outdoor only, Waldorf education includes a connection with nature, which includes being outdoor. So I think we're the perfect pedagogical approach to have outdoor learning, especially during a pandemic. So that's just my comment. It's my 2 cents. Any other comments? This is not something we're going to take action on right now, but any other comments before we close this item?
This is Heather. I thought we needed to make a motion to approve the one class at least that has been expanded. Is that correct?
That's correct. I need acceptance that I went over the
Okay, thank you, Heather.
plan in the one area.
I guess
this is Chelsea, and I would.
I was thinking we were
going
to put on. Okay.
This is Chelsea, and I'd be happy to make a motion that we increase the one class to above 16 because we have the facility space available to continue to keep those students at a safe distance.
I second
Thanks,
that.
Chelsea. It looks like Laurel's holding fast for a second. Okay. So we have a first and a second. Thank you. Is there any further discussion?
Can I just pipe in really quick and let you all know that the class that you are voting this for is my teacher, and that she really wanted to do an outdoor classroom situation, and going back into on-site learning, she did not have the manpower or the administrative backup to follow through with that, and that's why she is in the big room. If you're going to approve her having more than 16 students in her classroom, I would also hope that you consider that she gets what she has asked for with this outdoor learning ability.
This is Heather. I was actually just about to.
I'm all for that.
I was actually just about to inquire as to whether we could approve a second instructor with that class or an aide. If the number is going over 16, that seems like that would be a prudent protocol to follow. especially with the students being spread out so far. If they are in the great room, a second adult in the room, I think would be a really good idea.
So I'll address that first, Heather. She does have a full-time aide.
Okay.
Yeah, and that was the plan from the beginning. So do the other classes that are on the larger side or have significant special education students. The problem we're having right now with the outdoor classroom that Jackie's speaking of is the size of the area. The need that we have for the number of students cannot fit into the outside area without blocking traffic for pickup and drop off. So we're kind of at a pause right now on that. And continuing to work with the great room. It's a portion of the great room, not the whole great room. And we also have air scrubbers in there daily, as well, of course, as sanitation. So if we can figure out the space outside, but the space that we initially measured, we didn't do a good enough job of measuring. And so it did not work out.
This is Heather. Could we have an item on the next agenda? An item on the next agenda. Sorry, I can't speak. Relating to specifically outdoor learning spaces.
Yes, I would love to do that.
Great. Should we? Any other discussion?
I have a question just before we vote on this to make sure I'm understanding it. So the reason why we made an exception with that one class is because at the time it was the only class with more than 16 students who wished to return to in-person learning.
Correct.
Okay, and then what we're voting on is not making future exceptions beyond that one class. Is that right?
Mm-hmm.
Okay, thank you.
Well, not that we are not making future.
Can you guys hear me
exceptions, but
better
that's
when
not-
my camera's off?
I think it's about the same, Monica. But I just wanted to respond to Laura because I think with this one, it's specifically to this individual class. So any future exceptions would have to return to the board for approval on a case-by-case basis. So this wouldn't include any blanket exceptions for classes.
Which means from what Jackie said earlier, that the classes where we have 1 or 2 students that said, hey, I'd really like to come back on class. And if there's already 16 in the class, we'll be saying no until there's room within the 16.
So then when would that get revisited? So, I mean, like I said in the beginning, I only opted my child into the class because I was afraid that she would not be able to rejoin that class. And I understand that at semester break, you were going to relook at things. When is the conversation going to start that it will go beyond 16 and do 2 cohorts and that there's not a waiting list?
I think that fits into the discussion that we need to start having next, is specific to Governor Newsom's direction, because part of that direction, and I did have Alex bring the document forth. I think it's maybe what's being viewed right now. Yes, is that we do not increase the number of students on campus. That's one of his requests. That, let's see, can we go down to where schools are? There's schools. That if K-12, if already open, may remain open, but encouraged not to increase the capacity any more than is already in place. So to me, that increasing that capacity discussion would happen when we move back out of purple.
Okay, so then my next question is, if I'm afraid to go visit my father because he's a surviving cancer patient, and I want to pull my child out of Blue Oak and put her back on distance learning, prior to me leaving, well, then I have to go on a waiting list because her class is already over 16.
I feel like that's an administrative question, and then we have a motion on the table that we need to vote on. I don't know, personally.
I agree, Heather.
Because we're voting on a policy situation, not on a case-by-case situation. But I think I hear administration saying that they're willing to accommodate students, especially veteran students. And I imagine in a situation like that, there could be, I don't know.
Yeah, Monica, I think
So-
though that that's really outside the scope of the board, and that really is a independent conversation.
Okay. So we do have a first and a second. And after this vote, I'm gonna leave the meeting and see if that fixes further discussion. Okay, hearing none, let's vote on the class size 16 for Kari Madera's class. Vicky,
Vicky Wanacott, aye.
Chelsea,
Chelsea Parker, aye.
Tricia,
Trisha out there too. Aye.
Laura,
Laura Swanson, aye.
Laurel, Laurel, Laurel Hill Ward,
Sorry, I muted. Laurel Hill Ward, aye. Apologies.
thank you. That's okay. Heather,
Sorry, I clicked the wrong thing.
It's okay.
Heather
We'll
Boney,
get you.
aye.
Thank you. That's
Oh.
okay. And Monica McDaniel,
How do we
aye.
put it back?
And I too
There
would
we go.
Yeah, and I too would like further discussion about outdoor components. I think that we could get really creative. And I really, that's been my thing overall, all along. Because Waldorf education really has lots of room for outdoor education, and that's part of how we roll. So we like to bundle up. Okay, I'm gonna leave the meeting at the beginning of this. The next item, which is the BCOE memorandum of understanding. I'm going to try to leave the meeting and come back and see if I can get rid of my glitches. So I'll see you guys in a minute, but go ahead and Susan start with the MOU, please, for item 3.6.
Yes, so earlier in the year, BCOE reached out to me. They have provided us with on-site counseling for Campfire victims since the Campfire. It's been spotty. I think we've had 5 different counselors in that period of time. And so this year, when they spoke to me, they offered to basically just give us the money so then we can expand our counselors service rather than to bring another new person in. And I worked with Emma Todd, who is our social worker and counselor on site, and she agreed to it. So BCOE sent us finally, and it did go to the finance committee once, but we didn't have the documentation yet. And then we missed the next time. So I reached out to Chelsea, and she agreed that if we shared this with the finance committee, that it could come forward today to see if there are any concerns. So this is in order to give us $10,000 to put toward our counseling service for Campfire victims or other victims of trauma. So it actually can be used for COVID-19 services as well as the new fires here this year, the 2020 fires as well. So so what we do is Emma tracks what she's doing, and then we can report that to BCOE. So it feels like a really good adjustment and a supportive one overall of Blue Oak. So I ask you to approve the MOU with BCOE. Heather Bonea, as a second in command, would you take over the meeting for a few minutes while Monica's off?
Yes, that was just clicking in my brain that was probably going to be me while she's not here. All right. Anybody want to make a motion, or is there discussion on this item?
This is Chelsea, and I would be happy to make a motion that we approve this MOU with BCOE.
This is Laura. I'll second Chelsea's motion.
Great. All right, let's go ahead and let's see, is there any other further discussion before we put that to a vote? No? Okay, let's go ahead and start with voting. Vicki?
Vicky Wanacott, aye.
Trisha?
Trisha Ateertua, aye.
Chelsea?
Chelsea Parker, aye.
Laura?
Laura Swanson, aye.
Laurel?
Laurel Hillward, aye.
And then Monica is absent for this, is that correct?
That's correct.
Okay, and Heather Bonilla, aye.
Okay.
So motion passes. And let's see, are we waiting for Monica to come back in, or should we just continue?
We can
If we have enough votes.
Go ahead and continue.
We can continue. The next one is
Okay. Item number 3.7, accept offers of employment.
And these are just the changes that happened in the school year. We've had one aide, which we hired earlier in the year, and she did a good job for us, but moved on to a different employment. And then we had 2 new aides apply and have offered them positions. So we're just asking for you to accept the offers of employee and also then the resignation for an instructional aides.
Great, thank you, Susan. Any volunteers or discussion or questions?
This is Chelsea again. I will make a motion
Thank you, Chelsea.
to accept the 2 offers of employment and the 1 resignation presented.
Thank you,
I'll
This is
second that.
Trisha. There you go.
Oh.
I think Vicky, go ahead.
I'll second that.
Thank you, Vicki. All right, let's go ahead and see if there is any further discussion or questions. Nope. All right, let's put it to a vote. Vicki,
Vicky Wanacott, aye.
Trisha,
Trisha Ateertua, aye.
Chelsea,
Chelsea Parker, aye.
Laura,
Laura Swanson, aye.
Laurel.
Laurel Hillward, aye.
Wonderful. And is Monica still absent?
She seems to be. I'm texting her right now.
Okay. And
Okay.
Heather Bonilla, aye. I think that's it. So motion passes. A question before we move into faculty, Susan, would it be possible by our December meeting to have a first draft of a plan for the 2nd semester?
I will try, Heather.
Okay, we should at least have it on the agenda so we
Yes.
can discuss it.
Yes.
Okay, thank you.
Before we move on, I was wondering if we were going to circle back and talk any more about how we're planning to respond to the purple tier. I thought we were going to first have the discussion about the special class and then go back to that purple tier discussion. I'm wondering if that's the case.
So I'm gonna
Um,
wait on the
go ahead.
purple tier because we don't have all the information we need at this point. Can you guys hear me better now?
Eh,
Okay.
It's still pretty bad,
We
Monica.
were gonna have, wait, Susan, do you wanna respond to that?
Well, if Laura has more that she wanted to share that she didn't share before, I would be happy to hear it. I would like it before I go to my meeting tomorrow.
yes.
And Laura, before you jump into that, this is Chelsea. Monica, because of the
Mhm.
delay and it's still pretty hard to understand you, I would ask if maybe you wouldn't mind Heather finish out the meeting just to help keep things rolling.
Sure.
Okay.
Nothing against you. Thank you.
All right, thank you. Go ahead, Laura. Yeah, please share your concerns or questions regarding that issue.
I was just actually looking to hear what other board members felt about it. In addition to sharing that Chelsea, I completely recognize what the numbers mean, and I appreciate you kind of putting that in perspective. And I do think it's something I'd really love to see us give really careful consideration to, as I know we will, because the increase is really shocking. And I know we worked so hard to open the school and have in-person learning working. And I just feel concerned about seeing that spike in cases and then waiting until, like, God forbid, someone gets a case at school and then kind of responding to it rather than preemptively really considering what we want to do. So I just wanted to kind of lend that perspective.
Laura, I agree. It's, I don't know about cases in children going up. I've been reading, and I hope they're from decent sources, but that more young people are getting the virus. And I'm talking about children now, not just young adults like we've seen. But they also have the potential to take it back to vulnerable family members. So it's a time for caution. It's a very frustrating year, a very difficult year, but the old saying, safety first, springs to mind. Thank you.
Thank you, Laurel, and thank you, Laura, too. Susan, have we had any documented cases at our school yet?
No, we have not.
Okay. I think that we had, when we approved our the safety protocol plan, I think there were protocols outlined in that plan for what steps the school would follow if we did have a documented case at the school. Is that correct?
I need to correct. There was, before we started, there was one case of a staff member, and everyone was notified about that. But we haven't had any confirmed cases in children yet. And I guess that's where my response to you is. And yes, we do have that. And we've actually, now I'm working, whenever the issue comes up, I work directly with Natalie, or Chris Furtado and I work directly with Natalie Wren, who's our nurse. And then she she reaches out to the health department and double checks with them. So we're doing what we need to do in cases. And what we have had so far is cases of relatives of children who have tested positive. So the likelihood is there'll be one coming down the pike soon, but but we haven't had one on campus yet. So.
Is there concern from the board about, in light of the county's status is in the purple tier, is there concern that our strategies that we have outlined for dealing with positive cases needs to be revisited? Is that something that I'm hearing from board members, or just wanting to have a discussion among the board about acknowledging that this is a rising concern in our community?
I personally feel like we outlined and addressed that really well. I feel like when we had the discussions to open, we really did kind of weigh those things out with the recognition that, especially because not only schools were reopening, but lots of things were reopening as we lowered our tiers. So there was an expectation, at least in some, that we would see an increase in cases. This is a very rapid increase in cases, so I certainly, see the need for, for the governor to make the decisions that he's making and closing things down. However, I feel like the protocols that we've put in place and the spacing and sanitation and standards that we have outlined really are still applicable, and should still be followed. And they were created with the expectation that at some point we will likely have a positive case. And so for me personally, I feel like, that outline is still fantastic and should be upheld, obviously, with, just continued assurances that it is being followed. And I have full confidence that it is.
Okay. Anything else from other board members?
I just wanted to agree, and I think that our plan is really good in terms of what we will do if there is a positive case. And I think a point of concern for me is as things are kind of closing back down, more so with this purple tier, I was actually surprised that we would even be allowed to stay open in the purple tier. So that's something that I think I'm kind of just trying to figure out and trying to put myself in the place of teachers who are now having to work with this kind of increased risk. And just, to clarify, I'm not suggesting that we need to change our plan. I think it is a good plan that we came up with, but I just wanted to have kind of a discussion around it and some kind of thoughtfulness of the risk as it's increasing.
Thank you, Laura.
I would like to ask the staff how they're feeling. Brianna and Riley, how's it going? We actually were talking about this a little after school today. There's kind of no real easy answer to this, because the thought after all the work that's gone into opening, the thought of closing back down again and what that means, particularly for at-risk children, is really disheartening. But at the same time, the increase to purple is really scary. And I did comment that I'm like, I don't know why we have a loophole for purple tier. If the whole point of purple tier is to lock down things to prevent spread, that then there's a loophole that arguably a pretty high risk setting can stay open. And that seems sort of anomalous to me. Kind of what I was ruminating on as you guys were talking was that this is probably going to be a situation that develops rapidly. Chico Unified meets to discuss it tomorrow. Charter leaders meet to discuss it tomorrow. I think I'm probably concerned that we wouldn't be revisiting a possible switch back to full distance learning until we already return in the first week of December or later in December. So I guess maybe my request would be maybe at Susan's behest, based on the meetings that happen this week, that potentially calling a board meeting early next week, if it's really trending towards the schools in the area moving towards closing, that we be prepared to visit that as well. I don't think this is the time to be an outlier, as much as I deep in my soul do not want to go back to distance learning, but I also don't want to be the school endangering staff and children as our community cases are rising. I know Chico Unified was discussing watching more closely the case numbers in the schools over the case numbers in the county. So that's a factor as well. In terms of really talking to other teachers about it, it's been a quick thing and we're all kind of up to our eyeballs with the turn to hybrid. So there hasn't been a lot of chance to talk specifically with other teachers. So I'm really speaking for myself in this one. It's also concerning. I was just trying to look up testing options and considering next week plans, and now testing everywhere is impacted. And actually, interestingly enough, unless I'm declared a high risk setting, which maybe I am or not, I can't even get tested at one place. So yeah, just some of the factors I've been considering in this.
Thank you so much,
Thank you.
Brianna. I think that is
Yeah.
really, really wise and valuable input.
Yes. And Brianna, too, I hope you know that we would want to be supportive of that. It's interesting to me that the symptoms for some people are so very, very mild that they may not know that they are the point of contact person. It's very concerning. And it's brought home to me more because my dad and a couple other people I know are COVID positive, and their reactions vary greatly.
I think it's very valid that every board member should be kind of on high alert over the next couple of weeks of the possibility of a special meeting being called. So just make sure that you're extra attentive to your emails and whatever communications you have for the Blue Oak Charter Council. Any other discussion or questions on this topic?
Yeah, before
Chelsea?
we move on, Brianna, I think, is who mentioned Chico Unified trending towards looking at the case numbers in schools versus cases as a whole. And Susan, I would just ask if there's a way to get that information separated out. I mean, I know on the public health website you can see by age, but it doesn't really break down which of those people in that age group are physically back on campus and which aren't. So oh, I see Sarah says it's available on Chico Unified's website. So I just think that that would be really relevant as we do have meetings, because we certainly will be talking about this for a long time. So I think that that data would be super relevant to be in the board package anytime we're talking about making changes or considerations. I think that would be really helpful.
Thank you, Chelsea. I agree.
Yeah, I will, if I can, I will check and see. I know that Chico Unified is keeping track of each of their schools and how many cases per school. I don't know if they're talking in that about, so we'll find out tomorrow, if they're talking about their schools and saying, here's this school with 1 case, and here's this other school with 10 cases. We may want to shut this school with 10 cases down. If they're talking within the district or if they're talking about the community as a whole. I would love the information on the community as a whole. And I will bring that up at Charter Leaders tomorrow to see how we might be able to get that information. I also, the other thought as Brianna was talking that I had as an idea to bring to the board is really a plan for closure. So if there's a point, we know that the health department will close us if 5% of our student population gets COVID. We know that. That's what they've told us. But all of our plans are really that until the health department says we close, we stay open. Do we want to revisit that part of the plan and say, you know, if this, that, the other thing happens, we'll consider closing again, or, you know, that sort of thing. So we're putting in some parameters for the decision. You know, one of the hard things for me yesterday was like, what do I do for tomorrow? And based on what the district was doing and based on the information from the county office and the county health department and the governor, I said, we'll just go ahead and stay open the remainder of this week because that is a working plan for right now. But I kind of had to make that decision on my own because there wasn't even enough time to get an emergency meeting together. Yeah. So I think having maybe some guidelines to say, if these things start to happen, we want to consider closing.
Thank you, Susan.
Coming up, Thanksgiving may be a time that really changes things too, because some people may not respond to it by being careful. You know, it's a time of family gatherings, so it'll be interesting.
Susan, can we have that on the next agenda as well? Or Alex, can you put that up for the next agenda, next meeting agenda? A closure policy?
Yeah.
Thank you.
Susan, I just wanted to,
go ahead.
oh, sorry, Heather. I appreciated your idea about bringing up that piece. I think you said if 5% of our students have COVID, that we would be closed, right?
Mhm.
And to me, that does seem kind of like a lot of students testing positive. And I'm wondering if we could, it's such a hard balance, but I wonder if we could get to a place where we're being a little more preemptive with that rather than reacting once that many students already have confirmed cases. And it could just be me, but that does seem like a lot of cases for our school to have before we actually close.
Yeah, it's 14 cases based on our projected enrollment. But yeah, that's a lot for our little school. And that doesn't take into account staff or, other contingencies.
Yeah. So definitely something to look for us to look at. Laura, thank you.
Thank you. Any other discussion or questions before we move on to faculty grade level reports? Okay, wonderful. Let's move on to item number 4, faculty 4.1 grade level report. Riley Murray.
Susan,
Hello,
did you want
hello.
to introduce or speak to this at all before Riley and I?
Sure,
talk?
I'll get started on it. Month before last, there were some questions about our use of fairy tales and specifically the Grimm's fairy tales in first grade, and how that approaches some of with some stereotypes and some characters that are pretty scary. The stepmother, for example, in Snow White is not a nice person. So I brought that to faculty too. We have the pedagogical team, which is a team that works on how we are, of 3 teachers that works on how we are implementing Waldorf at the school. And also included in that discussion are co-chairs who are here tonight. And so they had some really deep discussions about how to address this and what to address. And so they prepared a presentation that that Riley is going to share with us now with her great tech skills.
Thank you, Susan. I'd like to think my tech skills have come a long way. So Brianna Lee will be sharing the screen.
Okay.
as we
Hold on
Share
just a-
this presentation together. As Susan was saying, we've been meeting with the pedagogical team and other members from our community about how to go about this.
I'm working on it, Riley.
It will soon be on your screen.
I have like 75,000 emails. There we go. Nope, wrong one. I'm so sorry, guys.
Want me to share? I have it
Nope,
up.
I found it.
Okay.
Yeah, and I
Teamwork.
would just add to Susan's introduction, that was an excellent one, thank you, that just as an FYI, our pedagogical team is made up of all Waldorf certificated teachers. One of them's taken a class through most of the grades. We've got a kindergarten teacher in there. I'm Waldorf certificated. Riley's in the process of it. I've taken a class through the grades. So it's a pretty deeply experienced Waldorf group. And that's kind of the intention of the pedagogical team, is really to have, when these bigger pedagogical questions come up, that they're really coming to it with the knowledge and the experience to discuss it. All right. Right one, right, Riley?
Yeah, can you just, perfect. Perfect, thank you. Okay, yes, I'm ready for the next slide whenever. Also, Mrs. Madera and teacher Cheryl put together a little puppet show for us at the end as a little treat. The fairy tale. If you want your children to be intelligent, read them fairy tales. If you want them to be more intelligent, read them more fairy tales. Albert Einstein. So you can listen or read at your own leisure. Also called Household Tales by Brothers Grimm, the fairy tales, for me and scores of others, our subconscious representation of our own personal journey, our inner struggle. Each tale may speak to each person in a slightly different way. While they are all said to hold deep meaning, some stories will be held dearly, while others will seem completely nonsensical or even bring up feelings of discomfort. Recognizing this discomfort will have significance in itself. The tales are not intended to be taken literally. This is something that may be harder for the adults to achieve than the children. Children are, by nature, closer to the fantastical dream world than we are. We adults are much more entrenched in our intellect. Waldorf pedagogies say that to bring our literal awareness to our children too soon can actually disrupt the child's natural development. This is a completely different experience than that of the television or movie program. From the screen, the images are presented and permanent. There is no room for imagination. Even storybooks do not have the ephemeral and nebulous, uh-oh, the screen just cut out on that part. We're working on it. Quality of a spoken fairy tale. Okay, thank you. And you'll see on each slide, Teacher Cheryl has incorporated her puppet show table display. So you're seeing how she is acting out different tales. Bree, did you want to add to that?
Yeah, and I was just going to say, this was actually one of the places where we had probably the longest discussion on this, was just this idea that, you know, we really do try to hold the child's innocence, if you will, and we compared to, way, say, maybe in traditional education, they would just like, I always use the example I got given of training of like, tell them about the deforestation of the rainforest in like first grade, and that this is this huge heady concept for them to comprehend, versus that there's these fairy tales where these things can happen in these fairy tales that can seem very harsh to us as an adult, but because the child knows at a like deep level that the fairy tale is a fantasy, it's a fantastical experience, that they're sort of absorbing this hardship at a level that's developmentally appropriate for them. Like they know it's fantastical what's happening, but they're also kind of getting a chance to experience hardship in a way that their brain can take in. And that's probably a whole larger discussion separate of this presentation. And I think we'll talk about this later, that how much the story cycle is meant to directly speak to the development of the child at that age, including the hardship within the story cycle is meant to be meeting the development of the child where they are. And we kind of each shared a story of experiences that we've had in the curriculum over the years, where we as adults, putting our adult head and our adult consciousness on it, had to kind of wrestle through what the story is, bringing the story, adapting the story, et cetera, and things like that, to bring it to the children, and what kind of came forth from that own inner work of ourselves, because Steiner talks so much about how important that inner work is for the development of the teacher. We'll go ahead and click forward, Riley.
Thank you. Yeah, one thing I shared with the group was that the year before taking my first grade class, I was in a fourth grade class at a local school, and they had a story that fourth graders read about a parent being in a car accident. And that's very real for some people, myself included in that. And it was really difficult to talk to fourth graders about that. And then just to feel the difference of moving from that world into a place with fairy tales was a very different feeling for me. Okay, continuing on. The fairy tale is one of the foundations of our language arts curriculum. Steeped in rich language and vivid imagery, hearing these tales encourages children to stretch their imagination, build focus, develop vocabulary and comprehension, and strengthen their ability to recall. In our fast-paced modern times, it is also a much-needed still point in the day, an in-breath. Over the years, I have striven to bring balance to the classroom with the fairy tales. My struggle has been to find a balance between archetype and stereotype in the stories, and also in holding interest but not bringing too much drama. All good, no worries. My solution has been to try to find stories that speak to me as well as the group before me, not an easy task when teaching remotely, and also to be sure to supplement the grim tales with those that include strong female characters and or represent diverse cultures. This year in the puppet shows, the knight was a girl who slayed the dragon in order to rescue the fair prince. The clever girl who outwitted the big bear had brown skin, and other characters have been gender neutral. The protagonist in Star Money trusts in the great good. And I just love this puppet display right here. It's my favorite.
This was another strong point of discussion too amongst our team at this meeting, that, you know, within Waldorf pedagogy, there's a very strong belief in the sort of intentional connection that the teacher has to the children, and that picking a story is not simply like, oh, I need a story to tell now, this will do. That there's a lot of higher order things that go into the selection of the story. Like, yes, there is the story cycle, and like, oh, story of the brown bear fits B, but also like, what in this story is feeding the children that are before me? What do they need? You know, who needs this nudge? Who needs this holding? Who needs this beautiful imagery? You know, what do we need as a class from this story? And that's something really that the teacher is intentionally thinking of in every story that they select.
And I also believe that's part of why it's called a healing education, because we're able to bring those gifts and those students and those lessons through different stories. There are so many more profound thoughts on the fairy tale than what I have touched on here. Bruno Bettelheim's The Uses of Enchantment, The Wisdom of Fairy Tales by Rudolf Meyer, Clarissa Pincola Estes's Women Who Run with the Wolves, and of course Rudolf Steiner's lectures are just a few examples of how we can dive more deeply into symbolism, relevance, and inner journeys associated with the fairy tale. And I believe the next slide is our puppet. Oh, our puppet show is after this. This is the spiral of Waldorf curriculum. And you'll see it's an inward and outward spiral in one. So if you follow the red line, that's where we start in the lower grades. So we start with fairy tales, legends, fables. And in third grade, we start with Old Testament, going into sagas, epics. You'll hear about Norse myths in fourth grade, myths of ancient Persia and Egypt and Greece, Rome, Islam. So right in there, that's when our middle school is really taking on those exciting things. And in a traditional Waldorf high school, that's when we'll begin to go move into the blue line. But also many of the things that you'll see on the blue line, you'll also see in many other high schools and represented in different ways. Oh, yes, of course, resources. We as Waldorf teachers continue to strive to better ourselves as individuals and improve our work as teachers. And so Teacher Cheryl was so kind to gather some of these resources for us, for anyone who is interested.
Yeah, and several of these articles really pretty directly address the questions about the violence in the Grimm's fairy tales and in other stories that we tell in Waldorf curriculum, and you know, how the child processes them. You know, some of that we touched on here, but if you want a deeper look into that, these are some good articles to look at and read further.
I believe if we hit play, it should work. I'm not sure if we have time for that. a very sweet story.
Please go ahead. Yeah.
Sorry, we go, yeah. I realized I was still muted. I was changing the settings so you can hear.
Thank you. Anything can happen in fairy tale or rhyme, beginning with the magic words, once upon a time. Once upon a time, there was a little girl whose father and mother were dead, and she was so poor that she had no room to live in or bed to sleep in. And at last, she had nothing left but the clothes she was wearing and a little bit of bread in her hand, which some charitable soul had given her. She was good and pious, however, and as she was thus forsaken by the whole world, she went forth into the open country, trusting in the great good. Then a poor man met her, who said, "Please, give me something to eat. I have no food for days." She handed him the whole of her piece of bread, said blessings to you, and went onwards. Then came a child who moaned and said, "My head is so cold. Please give me something to cover it with." So she took off her hood and gave it to him. And when she had walked a little further, there came another child who had no jacket and was frozen with the cold. Then she gave it her own. And a little further on, one begged for a frock, and she gave away that also. At length, she got into the forest, and it had already become dark. And there came yet another child who asked for a shirt. And the good little girl thought to herself, "It is a dark night, and no one sees you. You can very well give your shirt away." And she took it off and gave that away also. And as she so stood, with not a single thing left, suddenly some stars from the heavens fell down round her. And they were nothing but hard, smooth pieces of money. And although she had just given her shirt away, she now had a new one, which was of the very finest linen. Then she put the money into it and was rich
for the rest of her days. Of linen soft, of linen light, we weave for you a dress so bright. You gave your clothes all warm and fine. We'll wrap you now in starry shine.
Thank you, Bree, for sharing our slides. I don't know if Teacher Cheryl's here, but thank you for putting that together for us. That was so wonderful. I always loved listening to that and her magical voice.
Thank you so much, Riley and Brianna. That was really beautiful. Made me miss being in kindergarten with Miss Cheryl.
And
So
I
fun.
just kind of add as a closure that, you know, the whole looking at the story cycle in light of a lot of topics of discussion in our world right now is the work of kind of the Waldorf community as a whole. And this is work we are working to undertake as teachers, is to look at places in the curriculum where, you know, story imagery is problematic, where maybe it's, you know, not representative enough of the cultures it's coming from, and some of those bigger questions. It's just the work of time and study and inner work.
And I can't even imagine how hard it must be to do all of that remotely, just having been a teacher and knowing how much of the importance of that story is a part of the delivery to the students and being held in the classroom by a gifted storyteller, and how much that kind of informs how the story is taken in by the children, and how hard that must be to do when you're just not there physically with them. And so my heart goes out to all of you guys having to make all of those decisions, and in a way that you haven't had to ever before. All right, thank you so much. Any other comments or questions on the grade level report from other board members?
Thank you,
Wonderful.
guys.
Oh, thank you. Yeah, perfect. All right, let's move ahead.
Before we move on, Heather.
Go ahead.
Before we move on, the idea of parent education nights, I posted that in the chat, and I think that would help this situation. Ryan was asking if it could be agendized, but this isn't really the place to discuss it. It's not really a board function. It's more of a pedagogical function. And so scheduling some sort of parent education night, because that's how we learned about all this when we were first and second grade parents. And that gave it relevance, and it was the opportunity to discuss it and really tease it out and understand why we use these fairy tales. So I just wanted to comment that was in the chat.
Thank you, Monica. Yes, that would be a good thing to be able to move forward on for the rest of the year, is trying to find a way of having some kind of virtual parent night, or even if there are other, like the resource you shared, Riley, if we could put together a list of resources and videos for teachers to access on our website would be great, where they could kind of get more informed on those topics. Item number 5, administrative report. Susan.
Okay. So first I just want to share, last year I did a lot of little anecdotal student stories, and I wish that I had done that and collected those this week, because I can just tell you there is a tremendous sense of joy and enthusiasm, both with the children and the staff, to be meeting again with with the children. And one story I did have today is one of the first through third grader was arriving, and the staff member said, "Oh, you know something about," "Well, yes, I'm happy." She said, "I'm at school." So just know that's just generally the feeling of those students that are returning, is they're just really happy to be here, and very positive and very helpful. So first of all, a little bit on some fundraising things. I had told you a while ago about a grant that I'd written for CDE. We were noticed last week that we didn't receive it. There were 300 applicants and only 10 recipients. From what I could tell, they had about $100,000 total. And for the state of California, 100,000 isn't very much. Our annual fundraising campaign, we reached out to North Valley Community Foundation for their week of giving. And as a school, we do not qualify for that. So we got some good ideas and some good writing done, but we were not able to participate in that. But we're continuing to move forward with other ideas. Chelsea did a good job of discussing the employee assistance program. This has been just a really important step forward, I think, for the staff, and it comes from just a sense of looking at what we see staff as needing, and as we move through yet another trauma and want to be able to manage what we need. There's other assistance besides mental health. There's legal assistance and other things. So it's really a place for staff to reach out when they have one of those once in a lifetime kind of questions and don't know where to go. So really glad to be able to offer that. Next, we really haven't had a chance to review our strategic plan, but I went ahead with some of the individual items that we had, marketing and enrollment being one of them. So I've written up the work that I've done so far, and I'll be working further with faculty or with the finance committee, excuse me a minute, on it. I've talked to, over the past months, 6 actual marketing firms, 3 that are really focused on the social media, web-based outreach and marketing. And that's something that we had seen and talked about ourselves being a little bit weak on. And then 3 firms that just do general marketing here in the Butte, Glen, Chico area. And the 3 firms that were not specific to schools all were kind of at a loss of how to market for a school. They didn't really have any plans or examples that they could give me of that. You know, they were to some extent prepared to go and learn how to do it. But I wasn't sure that was the direction. They mainly focused on events or branding is what they called it. You know, setting up your brand well and that sort of thing. Though I did get some good advice from one of them overall, or 2 of them overall, they were more or less not interested in taking us on. The 3 companies that I did reach out to who specifically focus on schools were Premier, Scola, and Creative Webworks. Premier does more of an aspect of doing helping you with some planning and then telling you what you need to do, or making suggestions as to what you need to do as far as improving your visibility. But they didn't have a direct marketing process for social media. The last 2 companies both do have are focused on social media outreach and bringing in leads into the school, and have various ways of doing that. Both offer a blueprint or an upfront plan saying, they look at our school and make suggestions as to how to move forward. One of them then turns it over to you. The other one then you add an annual contract. So they both do the same sort of things. And also have, of course, past or current clients that I reached out to. And of course, they had good things to say about both companies. And anyway, in this, by just looking and talking to them, I would estimate if we were to do a sort of an annual plan, it would run about $15,000 for the first full year. We're not in a full year mode right now. If we were to do something now, it would really be only half a year, starting in January and moving on. So based on that, I also pulled in the numbers, really the numbers as they are right now, which we all know change from week to week, as we talked about earlier. So I took the potential numbers of where we are now and looking into the future, and knowing that right now and for the foreseeable future, the in-person recruiting that we used to do, having booths at fairs and so forth, really isn't an option for it, though it may be later on in the spring. It's uncertain. And so a time really for us to take advantage of improving our online work right now. So these are the numbers for next year. And Heather, this is sort of what I was referring to earlier. As I said, we have about 295 students right now. And this first column on this is takes into effect, of course, the moving on of our 8th graders. And then we have the number of kindergartners that are either signed up for next year or are TKs and would be here again for another year. So the first column is how we look if all of the students we have now come back and no new students come in. That's what that looks like. So the second column is an estimate with the 22 in kindergarten, and I increased it back up to the 3. This model that I prepared is based on the idea that we wished to stay with a 2 classes per grade level. We have in the finance committee discussed some of that and begun looking at some numbers towards the end of last year. We haven't taken it back up this year about what would happen if we were to go down to 1 tier. So I did this based on 2 tiers. Not tiers, sorry, wrong day, wrong place, 2 cohorts, 2 groups of students going through 2 classes in each grade level. I could say that. So that would get us up to, if the second column were to come true, that would get us up to over 400 students. Our current building really is not large enough to really handle 400 students. So those are the second, and then the third column is what we would have to bring in. So I dropped that down to still having the 3 classes in kindergarten at 22 and then 26 per grade level, which is a more manageable number for our current building. And so that brings us down to about 126 new students that we would need to be looking at bringing in. So that also contributes to that 15,000. About the cost of that. That's actually a high number for those, but knowing also we would still get students through our normal ways of getting them through word of mouth and other things. So that's where that stands. Additional considerations. So this is built on the idea of building, increasing our enrollment next year, rather than going down to a single tract school. So the additional consideration that I'd like to talk about for this evening and potentially get a go ahead on is a offering for the 21-22 school year, a full kindergarten offering. And I have broached this subject with kindergarten teachers and also Sheila Moss, who previously was in the kindergarten and ran an after school program for us, to talk to them about what that would really look like. But what I'm seeing, it first came up last year at one of our community coffees, a parent of a lower grades student and who had other students here as well, said when she tried to outreach to her friends to bring them in, that they didn't come because we didn't have a full day kindergarten. And when I brought this up last week at finance, that also came up there with the parent that was there, and also one of our staff members that shared that it was difficult, even working here, to have your children in a half-day kindergarten. So so that's another option, is to begin to look on and to prepare. I would like to prepare a proposal of what that might look like for next month, and then we can begin to include that in our outreach materials. And the final thing in the area of marketing and enrollment would be to start a Waldorf preschool. And that's something that many people have brought to me as something that would be good for the school and good for the community, to really start when they're young, with them getting used to our way of looking at the world. But really looking at that for 22-23 as something that we might build an option for in the meantime. And then the last thing is that I have moved forward with reaching back out to Carrie Welch, who we worked with last year when we were looking at purchasing the current location. And she's looking for potential sites and talking to real estate owners for us. So we are looking for where we are going to be in 22-23 when our lease here runs out. So that's all the stuff that I have, along with working on COVID and opening. We're trying to continue to move forward in other areas as well, because when this is all done, we still will want to have a school. So that's what I've been doing. I would like to get any comments on what I presented, especially around the marketing and the kindergarten idea.
Anybody on the board have any questions or comments that they want to offer relating to this item?
This is Trisha. So for kindergarten, I think a full day is helpful, especially if you have other kids in grades. It is complicated to go and then go back a few hours later. But then I think that there are parents or kids that haven't been in preschool before, that it's a hard transition to then put them in 5 days a week full day. So, and I don't know if there's a solution to do both. So that would be my only thoughts.
Yeah, and Trisha, we are talking about that, which would be to keep a half-day option open, and then and have a transition period there in the middle of the day, so we could do both a full day and a half day. Montessori has done this, and so we got some Sherwood Montessori, so we got some ideas from them about how they did it, which we would build into any proposal we do.
Good. Yeah. I mean, I'm torn. Like, as a parent, I would love to just go once and pick them up, but like, I know, like, I have a kid that will go into kindergarten next year. He hasn't been to preschool, and going to school is going to be challenging enough, let alone having him stay all day. So,
and I think especially also with any of the TKs that are coming in, a half day would very much be beneficial to them. It's a full day is hard when you're 4.
Yeah.
Yeah.
And then with regards to the marketing, I think it's great to, like, you know, have a marketing plan and a budget to be able to really market ourselves and get out there, versus the word of mouth is great, but you know, I think really marketing ourselves kind of like a business is a really good idea, and to put money into ourselves to develop ourselves and you know, show other people how we can help them. So I like that idea. And then for the building, I would like to help with that. So when we do get to the point where we're meeting with people, I'd love to be able to help with all that. So
Great, thank you.
mhm.
I have my hand up. I'm not sure anybody can see it, but I think it might be interesting too to have a committee of board members, you know, one or two board or two or three board members who might want to do a little bit of talk about marketing. I know I'm in Toastmasters, and we have multiple times had people come and give talks to us about things, and just it'd be a way to spread the word. I just think there are other things that could be done. And when you talk about branding, we've talked a lot about the elevator speech about Waldorf. And the more I've known about it, I just absolutely love it, Susan. You know, I think I'm a career educator. And when I talk to you about what I'm trying to accomplish here with my grandchildren, it's so in sync. And the presentation tonight really spoke to me. And I just wonder if maybe we could, I'm not saying we take the place of a professional branding, but maybe 2 or 3 board members would like to form a committee to talk about how we can get the word out.
Yeah, I mean, the 2 companies that I'm talking to primarily, they're really about social media, which is the area that we haven't done as well as we would like to in. And it is a specific training and understanding that, you know, we have done, and if a lot of work on just redesigning our web page and talking about different ways of getting the message out. And yes, I think we need to continue to work on that. I'm not sure that it replaces the basic, this is how you get leads. And this is how this is how social media works for that. So it's a balance, I think, for both.
I would love to work with Chelsea on that. I'm on a committee to establish a bee museum in Orland, and we've made huge strides, and it's been a steep learning curve, but I feel like I've learned some things. And again, not necessarily a professional level, but anyway, I would enjoy working with anybody on that. And Chelsea, I saw that you volunteered, so thank you.
Thank you, Laurel. Thank you, Chelsea. Any other comments or questions? I had a comment and I think just 2 comments. I would love when we see a proposal for offering a full day kindergarten option. I loved what was brought up, I think, by Trisha about continuing, and seconded by Susan, continuing our half day program and offering an option for full day students or full day for some students who want it. And I would hope when we get a proposal for that, if we could have kind of a feel of teacher input on what the feelings are from the faculty about offering a full day program, that would be great. And then I love the preschool option, and I think that's fabulous, and I absolutely think that we need to do that, and have thought that for years. So I love seeing that coming to the board, and I would hope that that would be something that we could agree to move quickly on, to look into options for offering that, especially, you know, if we are having enrollment space for enrollment. I mean, it's kind of weird to talk about that now when we're only having partial students on campus, but when things do go back to normal, hopefully, that would be a nice option to offer on our campus. That's it. Anything else from anybody? Do you need a motion or anything on this right now, Susan, or? are we
No, I
coming
do
back
not.
to this?
I am just sharing the information as those things that we're working on to warm up your brains so that when we do have a proposal, it doesn't come out of the blue for you.
Great, thank you. And I did have one question for you that came up earlier in our meeting. I just wanted to clarify because I'm a little bit worried I may have misspoke. When we were taught, when you mentioned the 5% from the health department, if 5% of our students tested positive, that the school would be closed. So I wanted to clarify because I said 5% and I was thinking of our total students, which would be, 290 or whatever enrollment is. But I'm wondering if it is actually 5% of students that are actually on campus, which would be a much lower threshold of students that we would be looking at.
My understanding is it's those on campus because that's the number
Okay.
that they keep track of for us.
Thank you. So then that would just be 7 or 8 students based on the number of students that are on campus.
But
That
it's
is a
still
good
half
clarification.
of a class. So,
Yes. Yeah.
that, so it's significant.
Right. And so if it was a large number in one class, that, yeah. Perfect. Thank you so much. And thank you to the parent who brought up that question in the chat as well. And I don't think that 5%, does that include the staff that are on campus as well? Or is that just 5% of student population?
I am not sure if it includes staff or not.
Okay.
That's a good question. I'm not sure.
Yeah. Thanks. Okay. All right. Any other items to be discussed relating to the director's report? I'm really bad about looking down here to see if there are any raised hands. I don't see any raised hands.
Good job, Heather.
Okay, thank you.
Thank you.
Yeah, thanks, Monica, for letting me step in. It looks like you're doing better, maybe a little bit. Oh, but then you just froze. All right, so I think that brings our meeting to a conclusion. We did come up with a number of items to be brought forth on our next meeting. So we'll look forward to seeing those items on the next agenda. And then if everyone can just stay extra aware, and in case there are any emergency meetings that need to be called, that we can get on top of that quickly and efficiently. And it looks like our next meeting is, it says Tuesday, November 17th, but that's today. What's the correct date for our next meeting? Anybody have that?
Sorry
You can pull
about
it up
that.
on-
Let me pull that up real quick.
That's okay.
I believe it's the 15th of December.
It'd be the 15th.
Yeah.
Is it going to be the 15th? Okay.
Mhm.
All right. Wonderful. And without any further ado, I guess I will go ahead and call the meeting adjourned at 8:38 p.m. Long one, but not too bad.
We covered a lot.
Yes.
Yeah, we covered a lot.
For all your hard work.
Bye. All right. Thank you, everybody.
Bye.
Bye.